Is it depression or just ADHD burnout? My name is Dr. Reed Sutton. I'm a board certified adult psychiatrist, and I talk a lot on this app about the importance of providing neurodivergent affirming care. And I had a session with a patient today who was concerned that they may be feeling depressed. But when we actually went through their symptoms, we realized that it was ADHD burnout. So let's talk about the difference. So if someone is suffering from a major depressive episode, then they're going to have to meet criteria for major depressive disorder. So that means that they must have either a depressed mood and or anhedonia, meaning that they no longer enjoy things that they used to enjoy doing, as well as at least 5 of these other symptoms. So that could include things like poor energy, poor concentration, poor appetite, poor sleep, feelings of guilt or worthlessness, psychomotor slowing, as well as thoughts of self-harm or suicide. Now, ADHD can have a lot of similar symptoms. People might find that they're not enjoying things that they used to enjoy. They might be isolating, they might be poorly motivated, but they're not going to have all of these symptoms that someone with major depression has. They may not be feeling or functioning their best, but there's something else going on. And it's important that we distinguish between them because the way that you would intervene to help is going to be different. So things unique to ADHD burnout are that it's going to be triggered by things like overstimulation, having to mask one's ADHD, having to exist in an environment that is not conducive to the way that your ADHD brain works. And there's going to be a lot of feelings of overwhelm, maybe feeling detached or apathetic. And of course, this can look like low energy, low motivation, anhedonia. There may still be interest in doing things, but getting the motivation to actually start and complete those tasks is impossible. So this kind of utter depletion that leads to ADHD burnout is not going to be fixed by taking an antidepressant or by just going to therapy and talking about your childhood trauma. Of course, there are going to be some lifestyle interventions that are going to be helpful for if you have ADHD burnout or depression. So things like prioritizing sleep, good nutrition, exercise. But it's also going to be important that this person can first identify what their needs are, as well as make changes to their environment and set up structural supports so that they can better manage their ADHD symptoms in a non-ADHD world. So this might look like making sure that you have alone time. This might look like just giving yourself plenty of time to rest and recover from being hyper-focused or just on the go for weeks, if not months. It might mean breaking things down into small, manageable tasks or communicating with your partner about your needs and how you can change the way that you interact or the way that you distribute household chores or whatever it may be to better support you. Or maybe it's getting accommodations at work. But the point is that starting an antidepressant or increasing your dose of antidepressant is not the answer here. If you've had ADHD burnout and there have been things that have been helpful to you to recover from that burnout, then please share them in the comments below. I'm also putting together an email list for those of you who are interested in my content because I may have future courses or offerings and I want to be able to communicate directly with you all about those things. So if that's you, then send me a DM with your email and I'll see you in the next one.